without further ado, I want to begin by asking you the importance of all these changes that we have seen in the news about the issues of health and the importance of Medicare and Medicaid for Hispanic older adults and their families. And Dr. James, I wonder if we can start with you with some estimates that show that nearly 1 in 3 Hispanics lack health care insurance, and sometimes it seems that it's a lot more. How does getting Medicare will help improve the health of Hispanic older adults?
Okay. First, I'd like to thank you for inviting me to participate in this panel. It's great to see so many of you out here this morning to talk about this really important issue. And as you mentioned, 1 in 3 Hispanics under the age of 65 tend to be uninsured. And Medicare and Medicaid actually have very important roles in providing access to care, coverage for preventive services, screenings, things that can help detect problems at an early situation. We also find that when patients are aging into the Medicare system, many of them are coming into the system with health problems because they have been uninsured previously, and the access to Medicare as they age in can result in some stabilization of those challenges. I think it's also worth noting, given all of the statistics that you just heard from the previous speaker, that we still see higher rates of uninsurance among elder Hispanics. And so we have about 9% of elder Hispanics who still remain uninsured even after aging into a Medicare system. And those rates are triple that for African Americans, or triple the rate of African Americans and whites.
What impact do you think the changes that are being now talked about, Medicare and Medicaid, will have in our community?
I think those, some of this is to be determined because we will have to see what the actual changes are going to be. But I think when you think about one of the proposals that we heard a lot about this summer was increasing the eligibility age for seniors from 65 to 67 for when they age into Medicare. And that will have substantial implications because given the proportion of the population who's currently uninsured, that they will be less likely to have access to services. One of the reports that we had from our Medicare team looking at estimates said that if this goes in conjunction with health reform, that we would see large portions of that population getting coverage via Medicaid, some of those who are currently on Medicaid being what we would consider kind of those dual eligibles, and some are purchasing coverage through the exchange. This is balanced on terms of what happens with out-of-pocket expenditures. So because of the income inequalities that we see, and we know that about 40% of Hispanics have incomes below about 138% of the federal poverty level, and just to put that in a concrete number, that's about $29,000 for a family of 4 is what we're talking about now. The federal poverty level being $22,000, but as we age into we talk about health reform, we're thinking that $138,000. So those costs are not inconsequential, and that's one proposal in terms of aging into the system. The president just released his proposal for reducing some of the debt and deficits that we're seeing, and those have implications because some of those are payment access, payment issues to providers. And we don't just want to think about access from the perspective of what is the financial burden for the beneficiary, but will there be a provider who's willing to see that beneficiary in the economic environment that we're looking at?
These decisions by the super committee are going to be so important. And when we hear that we may finish with Medicare as we know it, everybody really is concerned, from the people who are receiving those benefits today to the ones who are going to receive it pretty soon, and to those who are just contributing in the first few years of work. How concerned are you about those changes?
I think we're very concerned about the changes and the implications that they have, particularly for underserved communities. These are lifelines, as you mentioned, and as some of the statistics showed earlier, in terms of what would happen for those populations were we not to have Medicare or Medicaid. And I think also it's hard to keep track of all the changes, but importantly also are those changes to Social Security, because we know that Hispanic elders, African Americans, are more likely to rely on Social Security as a major source of income, comprising 45% of their incomes, roughly speaking. So changes to those programs that can result in decreases in their income have serious implications for being able to age healthy and remain at home and continue to have a productive life.
With that, yes, please.
That though,
Ms. James.
one of the things though, I'm Teresa, Niño with the Centers for Medicare and Medicaid Services, is that, you know, as an audience and as a community, we can't look at it as a done deal. You know, this is something that is on the table, but also on the table are also our other proposals, and that's let's look at other measures so that we don't have to resort to certain measures in Medicare and in Medicaid funding or in Medicare or Medicaid cuts. So I don't want the community to feel that, oh, these drastic measures are going to take place and it's inevitable. You know, there is something at the table, and maybe the congressman will be able to address that, but there is something on the table right now that wouldn't be putting the burden on those people that need these services the most.